a lot of tall, spindly pine trees that just come down, even in a thunderstorm, and take the wires out. So it's been a blessing to have that.
Ben, why don't you take a look at your email real quick?
Okay.
I don't know who that is. Good afternoon, colleagues. Welcome to Faculty Council. I want to start with a few logistics before going into my more substantive remarks. We know we have a full house today, along with others watching on the live stream. And as you know, we've been challenged during this pandemic to figure out the best way to hold Faculty Council meetings from a technological standpoint. Today, we're trying another variation. As you can see, all Faculty Council members and guests are in the panelists category. This allows us to all see and talk with one another. We do have one resolution on our agenda that will require a vote, and we're going to see if we can do that without having to put voting members in attendee status as we've done before. I'll let Vin explain that further when the time comes. However, depending on what transpires, we may need to switch people into the attendee status. So if we need to make any changes, we'll explain that and then what we're doing and why, and please bear with us if that happens. Now I want to move into some more substantive comments. Any downtime I've had this week, I've spent thinking about what I would say to you today. As you know, last week, members of our local chapter of the AAUP published a letter calling for the Chancellor's resignation. I heard about this letter before it was published and wrote to the chapter president, letting him know that I disagreed with this choice. Other leaders in faculty governance also did this and called the AAUP's decision reckless. As I understand it from news reports, the vast majority, and that's a quote, of what was described as a 70-member AAUP members of the AAUP chapter supported this statement. Since the vast majority has no real meaning, what we know is that somewhere between 36 and 69 people actively supported this unsigned letter. This statement does not represent the 4,000 person faculty of the University of North Carolina at Chapel Hill. It is the view of people who released it, nothing more and nothing less. What is clear is that our campus remains deeply injured by events surrounding the removal of the statue known as Silent Sam. There is no one in this community who is untouched by current racism or by the historical wrongs that Silent Sam embodied. This week, I have talked with faculty members who told me what it felt like to be descendants of enslaved people on our campus during these difficult times. For many of us, our ancestry is littered with people who enslaved others or who benefited from the system of slavery. The legacy is painful for all of us when we really look at it. And so it is no wonder that new information published by the Daily Tar Heel raised new questions. I and others asked the Chancellor to respond to those news items, and he has responded. For some of us, that response was satisfactory. For others, questions remain. Although the Chancellor will speak for himself shortly, it sounds to me as though he has told us what he can about the situation, given the governance structure in which our university sits. I recognize many of us crave the particulars, the who, the what, the when, the why, and the how. And because of our student journalists' work, we know more of that than we did before. But the reality is that the people that can tell the whole story are most likely working at the UNC system level and or with the Board of Governors. If we want further answers, that is the place to look. Many people have called Silent Sam a lightning rod, and I think that's an apt comparison. A lightning rod draws down all of the energy from a storm into one place so that other structures are protected. In some ways, our continuing focus on Sam does the same thing. It keeps us focused on the statue and the settlement and diverts our attention from the other structures on our campus that perpetuate racism, both literal and figurative, and that desperately need our attention and focus. Students have told us about classroom experiences that alienate them. Faculty and staff of color voice concerns about current circumstances that need attention. And as we know, many people are working hard to move equity forward on our campus. But too often, that work is pushed only by our BIPOC colleagues. That is unfair and unjust. We all have to commit ourselves every day to equity in all of our work. In focusing on these present challenges, I do not want to suggest that the circumstances of the statue's removal, the proposed settlement with a group with ties to white supremacy and an inaccurate view of the Civil War is any less repulsive. It was and is abhorrent. And the fact that but for one judge, a $2.5 million settlement would have been the only way that that statue would be off of our campus is terrifying. Furthering the difficulty is that as a community, we have not had time to face and grieve what has happened. The December 6th Faculty Council meeting that has been pointed to of late occurred not 6 weeks before the first case of COVID-19 was identified in the United States. Now, over a year later, we are just beginning to feel like there is hope to move beyond the crisis. As we begin to come out of the pandemic, we will need ways to reorient and face all that has happened, including our experiences with the statue. We will need to think as a community, faculty, staff, students, and administration about what we have learned about truth-telling, transparency, and decision-making. To do so honors our commitment to and our relationship with each other. Over the last few days, Dr. Sibby Anderson Tompkins, Dr. Dawn Osborne Adams, and others have begun to think about a series of talking circles where members of our campus community might come together to talk about what these experiences have meant, what has been learned, and what we grieve, and what we want leaders in administration to know about how we hope they will interact with faculty, staff, and students when the next difficult set of circumstances or crisis hits, because such times will come. And we all need to learn what has happened and to consider how we might work together more productively. Not everyone will want to participate in these conversations. Some feel that talk is cheap, and I understand that sentiment. But as a plan and such invitations to join these talking circles come together, I hope you will consider participating nonetheless. We will never know which conversation will make the change and shift the narrative, and indeed, which drop will make the cup overflow. And with that, I'll turn it over to the Chancellor.
Thank you, Mimi. It's good to be back with everyone again, and I hope that you were able to recharge a little during this week's wellness days. There are a lot of things happening on our campus that I want to discuss, but first I want to address what Mimi has talked about. After I sent the email to campus on the settlement, many of you have expressed your support. I've been able to personally thank some of you. I want all of you to know that I appreciate you reaching out. Silent Sam has caused a lot of pain on our campus for decades. And I know the news of this most recent legal settlement reopened wounds for many people. That's why, in addition to the documents released in the UNC system DTH settlement, it was important for me to send a message directly to you last week to provide more clarity and context. Even though the statue is gone, the painful history of race on our campus remains. Silent Sam was a symbol, but those issues did not disappear when it was removed. That's why the first and most important part of our strategic plan is build our community together. And I'm inspired by the progress that's happening on our campus, even during the pandemic, slowly but surely, from the Diversity, Equity, and Inclusion Council to the History, Race, and a Way Forward Commission, and other important initiatives led by many people at Carolina coming together in a shared purpose. In addition to this, I heard from a few of you asking that I address what I've learned from my experience regarding the monument settlement. It was a good question, And so I'll share a few thoughts with you. The settlement was my first major encounter with the tensions of our complex governance structure that have existed since the founding of the consolidated university system. The reality is that we don't always have the authority to make certain important decisions that impact our campus. Pay raises are dependent on the legislative process. Certain HR actions, new academic programs, and finance authorities are set by the Board of Governors of the system office, most often, with input from the schools within the system. Changing our building names requires approval of our own Board of Trustees, and we experienced that this past summer. The authority of others external to the campus, yet within this system of governance, is well established, and they are our critical partners. Rather than challenge this long established system, it's more effective for me to operate within our governance rails, not outside them, to accomplish important outcomes for our campus and for the UNC system. And even within those governance rails, I have to navigate and balance different constituencies who often have competing priorities, interests, and influence. I meet regularly and enjoy it, meet regularly with and listen to several faculty groups, student leaders, the employee forum, our trustees, our Board of Governors, our system office leaders. And let's not forget about our over 340,000 living alumni who have opinions that matter. So back to this issue. In 2019, my role as then interim chancellor was not to decide the fate of the monument, nor was it to pursue, negotiate, or approve the terms of any settlement. That authority remains with the Board of Governors today. Some of you wish that I had rallied a public fight against the settlement the moment I learned it was under consideration, even if that meant risking that the monument would be forced back onto campus. That was a real risk, and it was not a risk that I was willing to take at that time. I was clear from the day I became interim chancellor 2 years ago that the statue should not and could not come back to our campus, and I did not waver on that principle. These past 2 years have been a journey, and I've learned from it. I've come to more greatly appreciate the severity of the opposition to this particular settlement. And I want to acknowledge that something else is part of that moment, something that can't easily be erased or forgotten. And that is the profound effect the very idea of the settlement had upon those in our community who have worked diligently in their professional lives, in their classrooms, in their research, and in their workspaces to strive for a vision of Carolina that is truly inclusive and one that lives up to its ideals. I do see and understand the unintended impact of these actions during that time on the general spirit of our campus. I also heard from many others in our campus community who believed the benefit of removing the monument from campus was nearly absolute. That regardless of their views of the terms of the settlement, they generally believed that any risk of returning the monument to campus was unacceptable, would be a direct threat to the safety and security of our community, and would stand as a continued source of division and disruption to our mission. Even after 25 years here, there's always more that I can learn about this incredible place and the amazing people in our community. And I learned again the value of partnerships, of collaboration, and of working together when we're driving the process. Which takes us back to our governance reality. We now confront a host of pressing issues that are vitally important to all of us and are dependent upon our partnership with the legislature, the Board of Governors, and our Board of Trustees, as well as our broader campus community. We need to continue the hard work in our reckoning with race on campus. We need to balance our budget while protecting our faculty, staff, and the mission of our university. We need to expand on our academic footprint into new and emerging programs that'll help us become that reimagined university that we discussed at our first faculty council meeting of this academic year when we were just 6 months into this pandemic. We've learned so much during those past 6 months. We need to stay true to the promise we've made to our students and the citizens of North Carolina. We need to get back out on the Tar Heel bus tour to shine a light on how our teaching, research, and service continues to make lives better and change the world. At this week's Board of Governors meeting, they decided to continue our 5-year freeze on tuition to ensure we remain affordable for our students. It's one of the things that makes Carolina a special place. We discussed how UNC Chapel Hill's 4-year graduation rates have continued to improve and remain among the best in the nation, and we must ensure that continues. We must plan for the fall 2021 semester to be sure we're providing the best educational opportunities for our students. In December 2019, when I was named Chancellor, I made a pledge to be inclusive in our decision-making. Since that time, I've reaffirmed the value of building working relationships and trust across and within our governance structure. My leadership team and I continue to work hard to improve and to meet this commitment. We can begin to shape the governance rails in the appropriate places to help influence and generate more favorable outcomes. It takes time, patience, and usually a good bit of negotiation, but I've learned how we can move strategically in that direction. Carolina Next is an example. The new policy on removing building names from our landscape, our partnership with 2U to expand our footprint through digital lifelong learning. These are all recent examples where this is working. I need you to join me in this important work by helping me gather and put forward facts and data and personal testimonies that illustrate the impactful contributions of our faculty, staff, and students, and the value of the work we continue to do on this campus for the state and the world. Through COVID, through our financial challenges, and through our commitment to diversity, and to demonstrate how critical it is that we retain the resources, the authority, and the independence to continue to build and expand upon this critical work. At the end of the day, I am the Chancellor, and I must make the decisions that I believe are best for our campus. I've said all that I want or will say on the matter of the Confederate monument or the settlement. And I'd now like to turn to other important items. I asked all my advisory groups at the end of last fall what a successful spring semester would look like. And we are on track for that type of a semester. I've had the opportunity to talk with faculty and several students who've been back in person teaching and learning since February the 8th. All indications are that it's going well and that it's been great getting out from behind the Zoom screen for those who are able to do it. This is extremely important as we look forward and look toward establishing normal campus operations for the fall 2021 semester. And I want to thank all of those who've worked so hard to put the measures in place to make this possible. From our housekeepers to dining service workers to our librarians and campus health employees, you are all making a difference. And I will add to this, all of you who are still working and teaching remotely, you are playing a critical role for our mission. The Carolina Together testing program continues to run smoothly. This program is a great example of what our brilliant faculty can do. Dr. Amir Barzan and his team have built this from the ground up. They collaborated with Dr. Stephen King in developing the Hall Pass web app that everybody's familiar with now and is really making certain that this program works successfully. Our campus positivity rate remains extremely low at approximately 0.6% with nearly 70,000 tests conducted. And since February the 7th, that rate has been less than 4.4%. I want to commend our Carolina COVID-19 Student Services Corps with over 400 plus students who have been volunteering and have logged almost 10,000 hours serving our community. You've seen them in action when you've come by for your testing. We are excited to now be turning our attention to getting our campus vaccinated. And we've spent a substantial amount of time over the past 3 weeks on this endeavor. And you're going to hear from Dr. Wesley Burks, Quintana Stewart, and Kathy Brennan on our efforts to get the campus community vaccinated as we approach phase 3 of North Carolina's Department of Health and Human Services vaccine distribution protocol. Finally, yesterday we announced that Judith Cohn, Vice Chancellor for Innovation, Entrepreneurship, and Economic Development, is retiring after 11 years of incredible service. Judith has changed the culture of innovation and entrepreneurship here on our campus. We're grateful for her and for the amazing team that she's built that will continue this important work. So thank you, Judith. And now I'm going to turn this over to Provost Bob Lewin for his remarks. Thank you.
Thank you, Kevin. I'd like to focus my remarks on two areas. One is to share with everyone what we're currently doing as it relates to the planning for summer and for the fall. And then secondly, just give you a little bit of a further glimpse on the progress that we've made in pursuing our strategic plan, Carolina Next. First, with regards to planning, the roadmap implementation team in partnership with CCAC worked very closely in the planning of the spring semester. And we have continued to learn a great deal about COVID-19. And I think we've learned a great deal about how to keep this campus safe. We continue to work very closely with our clinical specialists in infectious disease and virology, as well as our public health experts, and also continue to maintain a very close working relationship with the Orange County Health Department. It is time to start thinking about the summer and also about the fall. And so we are starting to think about these things, even though it feels like it's pretty far away, and all of us are just anxious to sort of get through the spring semester through the remainder of the next several months. We have been consulting with our campus experts and public health experts in deliberating around our fall and summer plans. And we're encouraged by the increasing pace of the vaccine rollout. We think that's going to be an important part of making sure that the fall is going to be successful. And you'll be hearing a lot more about that from our campus experts. But what we are expecting is that we will continue to make progress consistent with President Biden's goal of having over 600 million doses available for the general public by the end of July. Vaccinations in the state and in Orange County continue to progress, although I think we would all acknowledge we would love to see this happen even at a faster rate. But we've learned a lot through our remote delivery of education over last fall, and we're learning a lot this spring. I'm glad that we have expanded some aspects of the operations of the campus. We have invited more students back this spring, and now are welcoming students and faculty back into the classrooms, although at a very limited level. It is our expectation that as the summer rolls out, this summer will probably look a lot like last summer, and it will primarily be supported by remote learning strategies, although there's still a lot of work and planning that needs to be done. And we certainly will not be ruling out the opportunity for some face-to-face interaction in the summer session. In the fall, we're going to try very hard to have the fall semester look as near to normal as we possibly can. But we do recognize that this is a moving target. We will be looking at the science. We will be consulting with our experts. and we will constantly be informing ourselves from all the information that is being collected from around the country, around the state, around the county, and what's happening here on campus. As Chancellor Guskowitz mentioned, we're looking at consistently improving trends across all elements of our landscape. Our cases are down at the national, state, and county level. Our percent positivity is down accordingly. And of course, the numbers that the Chancellor just shared, we have remarkably low levels of positivity. And I believe that the positivity rate this past week has been hovering around 0.2%, which I think is an incredibly low number. And I would just like to take this opportunity to thank all of you, our faculty, our staff, and also in particular, our students. I don't think that you have a campus positivity rate of 0.2 without an incredible amount of cooperation and participation and intent to remain in compliance with our community standards and be able to achieve such a low number. So I just want to personally thank everybody for their diligence in trying to do their very best to maintain our campus community standards as well as the standards that have been laid out by the governor. So a lot of work is yet to be done. The roadmap implementation team will continue to work with Campus and Community Advisory Committee that the Chancellor has charged, and we will continue to work together and keep certainly all of you appraised of the progress that we're making with regards to a summer and fall plan. I do want to just remind everyone that that there are other things that are going on across the campus that are reflected in the strategic plan of the university, Carolina Next Innovations for Public Good. And I would like to just encourage everyone to look at the most recent updated web version called carolinanext.unc.edu. And you will have an opportunity to look at all 8 strategic initiatives, our embedded 3 strategic objectives that are a part of each of the strategic initiatives, and the several strategic opportunities which are being pursued across this campus. This is a plan that has broad faculty and staff participation and also has involved multiple student groups in advising the campus as to how to proceed in various aspects of the strategic plan. As the Chancellor mentioned, one of the strategic initiatives that we are most proud of, and I would argue that we've made perhaps some of the most significant progress in over this past year, has been Strategic Initiative 1, building our community together. And so with the help of so many people across this campus who have taken an active role in making sure that all of these strategic initiatives are being pursued with great vigor and diligence. I'm really proud to just be a part of this and very happy that we're making such solid progress. This plan is only a year old. It was approved by the Board of Trustees a year ago, January. We had to make significant changes in the plan, mainly because of several events that were happening around us. And we certainly wanted to make sure that as we were thinking strategically across the landscape of this university, what we should be doing and how we should be doing it and when we should be doing it, that it was important to recognize that COVID-19 was going to have a rather significant effect on our abilities to implement our strategic initiatives, and also the changes that were taking place across this country, across the state, and even within our own community as it relates to race relations. And this is something that certainly remains foremost on all of our minds. And I think the comments, that the Chancellor has made and that has resurfaced with regards to Silent Sam, I think is an excellent example of how this remains foremost on our minds and appropriate for us to continue to acknowledge that this is perhaps one of our most important strategic initiatives of the 8, and that is building our community together. And so with that, Mimi, I will stop there, and thank you very much for the opportunity to make comments.
Thank you both. I appreciate that. And hearing from both of you, could we take a few questions, comments? I think we have time for that.
Sure.
So if people want to use the raise hand function to do that, that would be the way to go. Okay. I am not seeing any questions at this point. Are people able to raise their hands? I just want to make sure. Oh, okay. Larry, I see yours.
Sure, thank you. Sure, I'll throw out a question if everybody else is going to be quiet. Chancellor, I agree. We can move on from Silent Sam and focus on the diversity issues and people that are here now and are feeling silenced and marginalized. I'm still at the same point where I made basically the same comment this time last year, which is, I'm director of the American Indian Center and a professor in the business school. As a professor in the business school, I'm very well taken care of and supported. UNC's nominated me and will support me on basically a leadership training sabbatical next year that I'm not supposed to announce yet, so pretend you didn't hear that. But as director of the American Indian Center, I was just working on my resignation letter because I can't go in again and look the women that I work with in the face, knowing how underpaid they are. Mimi was talking about the incredible stress this is on minority faculty. This is hard. I really cannot do it. And I refuse to do it. Because when I, hear that see in the news that we got $8 million to fund a speaker series in the Center for Public Discourse, and we can't find an extra $10,000 to help pay my staff that are way underfunded. I mean, that sure the, get their names right, the Abbeys, I think, decided on that, but someone in development led that money that way, right? And we're deserving also. And I think we have more of an impact than a speaker series that will, anyway. So, this is really hard when you talk about a $5 million Build Our Community Together fund and that's our strategic initiative. I'm not feeling that. I've been asked through my work on the History Task Force to write the land acknowledgement for UNC to acknowledge that you're on our land. It's like me writing my own thank you note for a gift that was taken from me. I'm not excited about that, and I'm tired. Right? I'm tired of being in the same place I was this time last year as far as funding and my level of belonging at this university. So I will stop there. I appreciate the good things, but there's a lot of tough things as well. And hopefully the next director of the American Indian Center can figure out a way to make this better.
Well, Larry, let me just jump in and say that, Provost Bluen and I actually had a conversation about this earlier this week, as we're, as you well know, we're in the midst of making budgetary decisions. Our identity and cultural centers are extremely important to our campus community. We are proud of the fact that we have a diverse student body that allows our curriculum to come alive when when they're able to participate in that curriculum and view it through different lenses and different experiences. And so I want you to know that we are committed to our 5 identity and cultural centers. We're working on a plan to be certain that they can be funded and not only to just maintain the status quo, but we want to see these centers thrive and that the students can thrive because of their participation within them. So hang with us. I'm asking you to. You're doing an incredible job there. I understand unlimited resources, but we're committed to you. I'm not sure, Bob, if you want to add anything.
No, I think you're right. We have talked extensively about making sure that all these centers are in a good place, and we recognize that it has not been easy at times, and a lot of that has to do with the historical funding model associated with these centers. But we are committed to trying to fix those things, and we have just this past week, Larry talked extensively about this.
And I'll also add that we are continuing to work hard to try to raise private funds for this as well. And I do think there are opportunities out there for us.
I guess I would just make the comment, Larry, that, I know that, when a big gift comes in and it's very targeted, it's somewhat narrow and perhaps doesn't address everybody's own needs, that might seem inconsistent, with our articulated views. As you know, development is a challenging space, and I think that the Chancellor and all of our development people work extremely hard to make sure that all of our development efforts, are done in a way that adds value in some respects to the campus. But what I think you have to realize is that a lot of these decisions ultimately are driven, by donors and their interests, and how they want to sort of leave their own legacy or mark, on the campus. So there obviously are many things, many needs that we have that go well beyond the framework of development.
But I do think that's something that we probably need to track as faculty governance, just to make sure that these specifics are kind of something that we're paying attention to too. So I appreciate you bringing this up, Larry, and that it's really important. So I'll commit myself to that as well.
And Nimi, I think in your comments, the conversations that you talked about trying to have this, there may be a place there for, how we engage our identity and cultural centers in those conversations, I think could be helpful.
Okay, thanks. Other questions or comments before we move on? We have a important agenda. Okay, I'm not seeing them at this time. So let us move on to Professor Corinne Fenig is bringing a resolution from the Committee on Appointments, Promotions, and Tenure. And at this point, I'm going to turn the meeting over to Corinne. How are we doing? Is there Corinne?
Yes, I'm here. Sorry, there was.
Okay.
Did you finish? Okay. All right. So yes, so the APT committee developed these recommendations because we were concerned about the immediate and long-term impacts of the COVID pandemic on our faculty's professional lives and career trajectories. Because these recommendations deal with promotion and tenure and impact faculty across the university, we seek the Faculty Council's support of these recommendations. In making them, we want to highlight that some of COVID's impacts are obvious, such as the closure of performance venues or research facilities. But others are more subtle, such as the slowing of publication times. But perhaps more importantly, some of COVID's impacts on professional development and career trajectories have not even been felt yet. And we're concerned that budget cuts, losses of funding and resources for scholarship and professional opportunities might go on for many years beyond these immediate impacts of COVID. We also want to emphasize that these impacts of COVID are not being equally felt by members of our faculty. and that the impacts are going to be different for members of our faculty. And so we hope that the university will recognize the potential for these disparities and deal with them in a way that is both generous and compassionate. One of the things that the APT gets to see is just the remarkable excellence of our faculty and the hard work that they put into teaching, scholarship, and the contributions they make to our communities and society. And so we hope that these recommendations will continue to support that work by the faculty and promote their success while alleviating some of the burden of stress and anxiety that many of us are experiencing right now. So I want to just thank you for taking time to consider our recommendations, and I'd be happy to answer any questions that you have about them.
Are there questions for Dr. Finnick? Okay. I think we're going to try and get the resolution up on the screen so that everyone can see it. And then, Vin, do you want to kind of take over at this point?
Yes, thank you, Mimi. Let me start by formally stating the question. The matter before us is Resolution 2021-2 on mitigating the impacts of COVID-19 on faculty careers. You have seen the resolution beforehand. You've had an opportunity to read it. It comes from the Committee on Appointments, Promotion, and Tenure, makes 6 recommendations, including some that would have to be acted on by the Board of Trustees, and urges the trustees, Chancellor, and the Provost to act on those recommendations. And so first, let me ask: is there any discussion? Are there any questions on this resolution? Okay, I don't see any hands raised. So I think, without objection, I think we can proceed to a vote. And because, as Mimi explained, we did not separate voting members from non-voting participants, and there are quite a few non-voting participants in the room, we will do this vote as a roll call. And I will ask in a minute Khadija Murray to call the roll. She will read the names alphabetically. So to save time, please unmute yourself before she gets to you, so we don't have to wait for people to unmute. Any voting member of faculty council whose name is called can vote yes, no, or abstain. And she has taken attendance in the participant list as we were doing other things at this meeting. So she will call only those names that are here. But just in case we accidentally miss someone, when we get to the end of the roll call, I'll ask if there are any other voting members whose names were missed, and you'll have the opportunity to vote. So let me ask Khadija to start calling the roll.
Deb Icott.
Yes.
Jay Icott.
Yes.
Rumay Alexander.
Yes.
Heidi Anxoris.
I'm here, but I just wanted to look at the resolution one more time.
We can come back to you.
David Burkhoff.
Yes.
Lee Berkowitz. Jessica Boone.
Yes.
Christina Birch.
Yes.
Lauren Burke.
Yes.
Yong Kai.
Yes.
Mimi Chapman.
Yes.
Larry Chavis. Catherine Clement. Jennifer Coble.
Yes.
Wendy Cox. Kimone DeVaris.
Yes.
Maybe healthy than one.
Katrina Donahue.
Yes.
Barbara Entwistle.
Yes.
Sue Estroff,
Yes.
Donna Falvo,
Yes.
Mary Floyd Wilson, Ronit Freeman,
Yes.
Jennifer Gates Foster,
Yes.
Martina Gintz,
Yes.
Wendell Gillen,
Yes.
Jacqueline Halliday,
Yes.
Carolyn Halpern,
Yes.
Sharon Holland,
Yes.
Kevin Jaffe,
Yes.
Joan Crawls,
Yes.
Anna Chrome Lukens,
Yes.
Jennifer Larson, Cal Lee,
Yes.
George Linsing, Amy Levine,
Yes.
Hillary Lithgow,
Yes.
Deborah Mayer,
Yes.
Beth Mayer Davis,
Yes.
Pasha McGrath,
Yes.
Jason Metcalf,
Yes.
Michelle Mayer, Tara Moon,
Yes.
Jill Moore,
Yes.
Beth Morocco,
Yes.
Eric Muller,
Yes.
Jocelyn Neal,
Yes.
Betsy Olson,
Yes.
Ricardo Padilla,
Yes.
Audrey Pettifor,
Yes.
Megan Plinge,
Yes.
Shitra Powell,
Yes.
Lisa Rahongdale,
Yes.
Joy Renner,
Yes.
Austin Rose,
Yes.
Julie Rudder,
Yes.
Hudson Santos,
Yes.
Yolanda Scarlett,
Yes.
Margaret Scary,
Yes.
Ryan Thornburg,
Yes.
Brian Thorpe,
Yes.
Debbie Thorpe, Teresa Triumph,
Yes.
Geeta Vaidyanathan,
Yes.
Tanya Von Dance,
Yes.
Todd Vision,
Yes.
Ruth Von Burneth,
Yes.
Megan Walter,
Yes.
Harry Watson,
Yes.
Joe Williams,
Yes.
Tim Wiltshire,
Yes.
and Kristen Young.
Yes.
Is there anyone else who has not had the opportunity to weigh in, who is a voting member? Please speak up now.
We have
Hi.
a number of folks, Finn, that voted in the chat because they couldn't get to their microphone soon enough. I don't know how you want to handle that. You're muted.
I'm sorry, we have
You're still muted.
sorry, how many of those folks do we have? 1, 2, 3.
About 5.
Okay, in that case, we have a record of their vote. And if anyone else needs to speak up, the motion passes, and we did it in 5 minutes. So thank you very much. And we've adopted the resolution. There are some hands up.
Yeah, Donna, are you raising your hand to vote? Or are you raising your hand because
Oh, no, I'm sorry.
Okay.
Sorry.
That's all right. Unfortunately, we can't use the raise
You
hand.
did get my vote though, right? In the chat.
We did get your vote, yeah.
Okay.
And I apologize about being muted. Sometimes my space bar works and sometimes it doesn't unmute myself. So here we are. But thank you. We are done with this agenda item, so we can move on to the next.
Terrific. I want to welcome Dr. Wesley Burks, who is the Dean of the UNC School of Medicine and the CEO of UNC Health. We've asked Dr. Burks to come just because we know that this has been a really amazing, difficult year for our colleagues in the medical school and in the hospital. And so we wanted Dr. Brooks just to give us sort of a quick overview of how our colleagues are doing in the medical school. I know many of you are in this room too. So we're going to ask him for that and then move to talking with Ms. Quintana Stewart from the Orange County Health Department, Director of the Orange County Health Department, about vaccine rollout. So Dr. Brooks.
So Mimi, thank you. I think Ben has some slides he's going to put up as I get started. So Ben, thank you. And Mimi, thank you. I just want to thank the rest of you just for the opportunity to visit with you for a few minutes. What I want to do, as she said, is just update you on what the last year for UNC Health, what happened, what it was like, hopefully some about where we're going. We're less than 2 weeks away from the 1-year anniversary of our first COVID-19 patient here in North Carolina, which was pretty dramatic at that point. And at the same time, our country is approaching 500,000 deaths, which is even hard to fathom what has happened. The last year for us has been interesting, frightening at times, amazing, filled with a sense of purpose, unlike any other time. But above all, it's just been plain hard, including, I know, for each one of y'all. Beyond the many professional and personal challenges due to the COVID pandemic, we've had financial insecurity issues, social and political unrest, kids at home and school. Most of our holidays where many of my coworkers were here caring for patients and others unable to gather with families, and many more unique issues for each one of us. I know everyone has faced challenges this past year, but of the many memories I'll have of our time during the pandemic is how we as an organization really had to embrace the overlap and the interplay of our personal and our professional lives. And those conversations have inevitably led to deeper bonds. I know that these stronger bonds that we forged over the last year will help us work better together for years to come. So Vin, if you'll go to the second slide. UNC Health is North Carolina's health system, and our mission is to promote the health and the well-being of the people of North Carolina. Just to help you appreciate a little of the size and the scope of the system, we have 35,000 coworkers, 12 affiliate hospitals across the state. Some are owned, some are managed, but we act as much as possible as one system. We have our own board of directors and are connected through them to the UNC system office and the board of governors. We're fortunate to have had the leadership of 4 individuals throughout the crisis. Our COVID leadership team has been Dr. Christy Page, Dr. Matt Ewan, Dr. Tony Lindsay, who you'll hear from later, and Steve Burrows, who is the new Chief Operating Officer. I want to acknowledge and thank them as they really led this effort on a day-to-day basis with the help of literally hundreds of coworkers across UNC Health. Ben, if you'll go to the next slide. The blue line is actual patients in the hospital, and the other 2 lines are the ranges, both high and low, that our predictive modeling would have shown. The pattern of COVID-19 patients starting last March, the initial bump in the triangle from people traveling in other larger urban areas across the state, the spreading of the virus across the rest of the state, the huge surge that started in November, the dramatic increases that we saw through November, December, even into January. And only in the last few weeks that we saw that begin to decline, but still higher than it was last summer when we thought it was high then. At the moment, though, there's really a lot of reason for hope and encouragement. So what I want to talk about for just a minute are a few of the accomplishments, things that we've experienced in this past year. If you go to the next slide, Ben. So during the initial period in March and April, we worked literally constantly to obtain PPE, personal protective equipment. Wherever we could, we looked. And of all the things that happened over the last year, this was by far the most bizarre and crazy, I have to tell you. We were literally negotiating multi-million-dollar deals for N95 respirator, mask, and other things, dealing with brokers in random locations all over the world to get supplies. My colleagues were often negotiating literally with over 100 brokers at one time to try to make sure that we had enough of these masks and other supplies. And thankfully, those issues have been resolved. In March, thanks to Melissa Miller and her team, we were one of the first academic labs in the country to launch an in-house COVID test that was critical early on for reliability for the state and others to increase the testing capacity. And it was a really big deal at that time, and it still is. To use the diagnostic testing available, we eventually set up 13 respiratory diagnostic centers like the one here at the Ambulatory Care Center all across the state. So many of my colleagues have worked tirelessly to set up through countless days and nights testing operations. More than 280,000 patients have been seen at the RDCs since their implementation. We're happy now also to contribute as partners with the university on what Kevin and Bob talked about earlier, the Carolina Together testing program. It's a really good collaboration from campus health, the laboratory teams, IT, many student volunteers, and UNC Health all together. I like the pictures on the slide because it highlights individuals from all across our organization. There's Amir Barzan, who was instrumental in getting our testing center stood up and now the work with the university. The picture at the bottom left is a group of medical students that you can see who volunteered their time throughout the pandemic. And on the right, there's actually an internet meme that was created after a picture of one of our nurses, Grace Sendrick, made it into the local papers. In the original picture, Grace is shown working outdoors at the ambulatory testing center here in Chapel Hill. And she pretty quickly became a symbol of strength and courage for so many healthcare providers around the country. If you'll go to the next slide, Ben. Early on in the pandemic, we expanded our advanced analytics capabilities and made those reports available all throughout our system so that this predictive modeling and the reporting on hospitalizations and a lot of other information, these models have been essential in helping us prepare people, equipment, respirators for the what's next as we walk through it. If you go to the next slide. The social and political conflict in our country, for many good reasons, had significant effects in our school, as well as the healthcare system community throughout the year. The health disparities in the Black and brown communities have been significantly worsened over the course of the pandemic. For several years, the school and UNC Health have been on a journey to ensure that our leaders and our co-workers reflect the different backgrounds and communities and cultures that we came out of. We had town hall Zooms for the school and UNC Health, our coworkers, that there were over 1,000 people on each one. We appointed a system-wide DEI council, appointed Dr. Crystal Sine as the UNC Health System Executive Director for Health Equity, outfitted a mobile van to take COVID testing and now vaccines to the underserved community, started a national search for a DEI leader to join our leadership team and lead our efforts in this space, and have continued to diversify our leaders across our organization. What you see on this slide are some of our new leaders at the executive director level or above across the school and the healthcare system who started their roles in the last couple of years. But most of the people on this slide have started during the time of the pandemic. And if you go to the next slide. Another way that the school and the healthcare system have helped in preparing and working through the pandemic is research into new therapies, new understandings of the coronavirus. This slide shows many of our School of Medicine, investigators that have been involved in bench and translational research related to COVID. Several of them were involved in the development and FDA approval of the new monoclonal antibody treatments. They are extremely effective, and we have them now available locally in 3 different sites at UNC Health. They're given by a several-hour IV infusion that will prevent hospitalizations in the at-risk COVID-19 patients. Also, we were fortunate to play a role as a site for the Moderna vaccine, the clinical trial, and now another clinical trial for the vaccine candidate developed by Novavax. It's being led by some of the investigators our infectious disease and global health group. There have been so many contributions that you've all read and heard about all across the UNC campus in the last year. I'll not get into specifics about the vaccine because you're going to hear a lot more about that in a few minutes, but I do want to share my personal experience at UNC Health with the vaccines. One, it's amazing that in the period of time that we had no vaccine and we literally had a vaccine to be developed. There are lots of problems with the rollout, but just to have one truly is amazing. I was in the room on December 15th when we were able to give the first vaccine to our frontline healthcare workers, and it was a special day. There was a sense of relief and hope, and for me personally, an outpouring of tears and emotions that I didn't see coming, honestly. So Vin, if you'll go to the last slide. Our two goals at the beginning of the pandemic were to provide outstanding care for patients with COVID-19 and to care for each other. In doing this, we've made a huge effort to provide resources and people to support our colleagues through our wellness program led by Samantha Meltzer-Brody. In a testament to these difficult times, literally thousands of my coworkers have used these resources during this really difficult time. If I look back and I've thought about it over the past year, there's so many lessons that I've learned that each of us have learned. We knew that we had a great team of really dedicated people, but it really has been amazing, and that's an understatement, to see their willingness to go above and beyond personally and collectively and work harder than they ever have without losing the empathy and grace that they show each other. I'll close with something I've recently shared with our teams and our boards, that everything that each of us have done in the past has prepared us for this time and the work we're doing. But we've really done nothing like it before. There's been a sense of urgency and intensity for all of us, and I've never seen so many people work so hard for such a lengthy period of time in my life. It truly has been an honor to work alongside my colleagues through the last year. So Vin and Mimi, thank you for your time, and thank you for listening to what's happened to us over the last 12 months.
Dr. Burks, thank you. It's left me a little speechless to think about kind of the journey that you all have been on. So thank you to you and to all of our colleagues at UNC Health. I wish we were in person so we could kind of more easily have a round of applause, but maybe we can do that. Please turn off please unmute and join me in giving our colleagues at UNC Health a quick round of applause.
So Mimi and Ben, thank you. Thank you for just the opportunity to be with you, and thank you for your constant encouragement.
Thank you. I'm very pleased to welcome Ms. Quintana Stewart, the director of the Orange County Health Department. She is going to talk with us about the vaccine rollout. I know this is changing almost weekly, and also is confusing to people. What happens in one state is different than what happens in another, and then our own state's rules and rollout changes. So I'm very grateful to Ms. Stewart for coming and talking with us about what's happening right now, recognizing that more change may come.
Good afternoon. Thank you for having me. Dr. Burks will be a tough act to follow, but I'll do my best. So yeah, I would just like to take a few minutes, and I think I submitted a few slides, not many, to kind of keep me on track with my comments today. But one, just talking about our vaccine distribution process here in North Carolina, and I can give you some specific numbers about Orange County, and more specifically about Orange County Health Department. I will defer to Dr. Lindsay, who is also going to speak in a few moments about the particulars of UNC Health system. We can go to the next slide. So first, I just want to point out and highlight for everyone that as a vaccine provider, whenever we sign our enrollment agreement, we attest that we will follow the vaccine priority groups as listed in the Department of Health and Human Services framework. And I just want to point that out because it is difficult, as each county has a different level of demand, and we all have this different allocation that we receive each week. It is hard for us to be in sync always with who we're vaccinating. But we attest and we sign and commit to following that priority list as close as we can. So I have an example here because I don't know, some of you may know about the medical center in Georgia, so Medical Center of Elberton, but they were recently, I guess, penalized because they went outside of the priority group and they were vaccinating some individuals that were not in Georgia's priority group at that moment. And as a result, you know, the Department of Health in Georgia suspended their vaccine allocation for 6 months. And while I love being in Orange County and we are known for being innovators and for being first at doing a lot of things, I absolutely do not want to put Orange County, and definitely not the health department, in a predicament where our allocations are turned off as a result of not following those priority groups. I would say, as a local health director, I think it's a great problem to have that our demand continues to exceed the vaccine allocation. I have some peers across the state where they have very little demand, and I mean, they can't get folks to come out and get the vaccine. And so that is absolutely not the case here in Orange County. And I'm happy about that. I'm happy to know that our residents are interested and willing to be vaccinated against COVID. We can go to the next slide. And so this slide, I just wanted to show our priority list as of today. And I'm really not joking about that. Those of you that have been paying attention, you know that this priority list has changed multiple times since we started our vaccination program here in the state. And so we are now down to 5 priority groups. And right now we are currently vaccinating the first 2 priority groups. But we remain flexible, and we know that this could change at any moment. And when it does, we brace ourselves and we shift gears and we make the necessary changes to meet the demand and the need of those in the priority group. You can go to the next slide. So right now we are currently vaccinating those in group 1, which includes our healthcare workers and our long-term care facility staff and residents. And we're also vaccinating those in group 2. And that is anyone age 65 and older. There have been some variations to these 2 groups, as I mentioned. And so I know in group 1, we now are also folks that are caregivers for, parents or medically fragile children. They are eligible because they're seen as being a healthcare worker. So they're eligible for the vaccine. So as time goes on, again, I say changes are made and we adjust and we accommodate as we can. As of next week, February 24th, we know that we will begin eligibility for some other folks will come up. So the governor announced last week that as of February 24th, child care workers and then the staff at our pre-K through 12 schools, they will become eligible for vaccine starting February 24th. And so with that, I will say that here in Orange County, we are one of the vaccine providers, Orange County Health Department, I would say specifically. We are a provider that won't be ready to move into vaccinating this new group that is eligible as early as February 24th. And the reason is we still have high demand and a large wait list for community members that fall in group 1 and 2. And so following the guidance from Secretary Cohen, and she sent out a letter to all of the county leadership, we will continue to work down our wait list in groups 1 and 2 before moving forward with setting appointments and trying to vaccinate those in group 3. So February 24th, the child care staff and the K-12 teachers, they are eligible to be vaccinated, wherever vaccine is available, and they can get an appointment. And then in March 10th, the larger group 3, everybody else in group 3, they will become eligible March 10th. So again, we just ask folks to continue to be patient, but we have great demand here in Orange County. And so we are staying the course and trying to vaccinate our folks as they are appearing on our wait list in groups 1 and 2. Next slide. So I thought I would just talk a little bit about the vaccine distribution plan, because I don't believe that is something that everyone is knowledgeable of or, very well versed in. And as a local health director, we get information updates to this pretty often as well. So again, vaccine demand continues to vastly exceed supply. Department of Health and Human Services here in North Carolina, they are now using a 3-week allocation strategy. And this helps us as a provider, one, to plan our clinics and to get staffing so that we can get the vaccine out as quickly as possible. So it's a 2-part allocation process. We get a baseline allocation coupled with some equity doses, and I'll talk more about that in a second. And then there's an allocation pot that is set aside for special events. So beginning next week, North Carolina, we got some good news, but our expected allocation for the state has bumped up a little bit. We'll now expect to receive 200,120 first doses allocated to the state of North Carolina. This number does not include second doses. So the federal government has continued to hold the second dose and ship those out in a 3 or 4 week period based on which vaccine is given. So we don't have to worry about second doses. So if you get a first dose, it's automatic that the second dose will follow. Allocations to the federal retail programs such as Walgreens and CVS, that does not come out of this pot of 200,000, nor does any of the allocation for the federally qualified health centers that are in that federal program. They don't come out of this pot of 200,000 either. Next slide. So for the baseline allocation, this is how they're divvying up that 200,000. Over 87% of the total first doses will be placed in a steady state baseline for providers over the next 3 weeks. So the weekly first doses, that'll be 153,650. That will be divided amongst all 100 counties in the state. And this number is based on the 2019 population data from the State Center for Health Statistics. Then within each county, vaccine is further divided amongst all of the vaccine providers that are enrolled, depending on what you reported was your capacity relative to other providers. So I would say here for Orange County Health Department, our base allocation for the next 3 weeks, we will get 400 first doses and we get 100 doses for equity purposes. This is we kind of lost 100. Last 3 week process, we were getting 200 first dose allocation and 400 equity doses. But again, as we have more providers come on board, then it's okay because they're just distributing the vaccine. So more people throughout the community will be able to vaccinate community members. So we have, again, I said this base allocation, and then you have this equity dose allocation. So there'll be about 20,800 doses that are allocated to counties to bridge some of the existing vaccination disparities that we're seeing. So again, I said Orange County Health Department, last 3 weeks, we received 400 doses. The next 3 weeks coming up, we're gonna receive 100 equity doses. So the equity doses are intended to be used on the priority groups. Right now, that focuses on those age 65 and older, our Latinx community, American Indians, our Black and African American populations. Orange County Health Department, we facilitate, we coordinate a human service committee that meets weekly. And this is made up of some of our county departments, such as Health, Social Services, Department on Aging, in conjunction with many of our community partners that work in these priority groups, our historically marginalized community members. So we meet weekly, and based on feedback from our community members and what we see as a need from the health department's perspective, we schedule these equity clinics to ensure that we can reach the target population without some of the barriers to electronic devices. So right now, a big part of our registration process includes someone going online, filling out the survey, and they register that way. Well, we didn't want that digital divide to be a barrier for some of the vulnerable members of our community. So we took that away, and we're using real community gatekeepers to spearhead and get us connected with this population. So to date, we've received 1,200 equity doses, and we distributed all of those doses within 7 days of receipt.
Wow.
We did a pretty large pod up in, point of dispensing, a vaccination clinic up in the northern part of the county in Hurdle Mills. We worked with the Latticeville Grove Baptist Church. So that was a big success. We did the second doses on that cold, rainy Sunday last week, Valentine's Day, but it was great and everyone came out and got their second dose. We did another large event in the Cedar Grove community. That was about 400 doses there. And again, we worked with community members from the Cedar Grove Community Center. So they did all the outreach and scheduling of those appointments. So that was a success there. And in both of those clinics, we saw predominantly African-American population, but we also had some members of our Latinx community show up as well. Last weekend, we also did a couple pods in the southern part of the county. We worked with the Hargraves Community Center and the Jackson Center to do more outreach in those communities. So again, we're very intentional, and we meet with community partners as well as some other county department staff to figure out how to reach the community and how we can get them vaccinated. I will say we would like to do more work with our Latinx outreach. To date, we have vaccinated approximately 3.6% of our Hispanic population. So we want to do more there because we know they make up 9% of the county population. So we just continue to do outreach and connect with trusted leaders in those communities to ensure we go to them and make the vaccine available. Next slide. So the set aside allocations. So this remaining pot of doses is about 25,670, and the state will use this pot to support various things that are likely to fluctuate. Some of that would be some of the community events, some of the larger events throughout the state where you want to have a specific targeted event. So about 10,000 of those first doses will be dedicated to counties that have received lower doses per their total population as compared to other counties. The state has done a great job, figuring this out. Week to week, they have to do these allocations, but they're human, right? So nothing's perfect. So they've gone back now and realized where some counties may not have received as much as they should have based on their total population. So some of the doses will go to make up for that, and then some will go towards some of these larger community events. I will tell you, whenever you're considering a community event, they look at a couple of things. So one, they're looking at equity. Are you going to reach members that fall into the historically underserved populations? They look at your operational readiness and speed, and they look at community partnerships. So I know here in Orange, we've been in conversation with UNC Health and Piedmont Health Services, but we're trying to figure out how we can collaborate and present a proposal to get some of these additional doses to vaccinate here in Orange County. So then you still have about 15,000 first doses that will be divided up amongst new providers as they are onboarded. And that's important because, again, we want to get as many providers onboarded in the community so we can spread out the effort of vaccinating the population. Next slide. So this is a list of current Orange County enrolled providers as of last Friday. We usually get an updated list each Friday. So the fact that the providers are listed here, that does not equate that the provider has received any vaccine to date. but it means that they are set up and they are postured and ready. And when vaccine is available, then they can get an allocation. Looking at this list, I know UNC Health, Health Department, Piedmont Health Services, the Medical Center on Friday Center, we have been consistently receiving our allocations over the last 3 weeks. So looking forward to some of the other folks coming online and joining us. There's actually a total of 18 providers that have been enrolled, but I know of at least 5 of those, they're not yet ready to receive their vaccine because they still have a few extra steps to do with getting providers or users set up in the COVID vaccine management system, CVMS. That's the statewide system that we all must use to account for and track our vaccine allocations each week. You can go to the last slide, I believe. And so this is just a map to say that while the process has not been perfect, I think Orange County has done a great job. I think it is a testament to our constant communication and collaboration with the UNC Health system, some of our other community partners. And so as of the data that was updated today on the DHHS site, Orange County has administered 25,718 first doses, 14,871 second doses. We are among the top 20 counties in the state with our performance to date. So about 17% of our population has received their first dose and about 10% have received their second dose. So I think we are doing a great job. Again, our demand continues to exceed vaccine supply, and we'll just keep working through that and getting folks vaccinated as quickly as we can.
Thank you so much. We've had a couple questions come in through the chat. Do you mind if do you have a few minutes to answer?
Yeah, that's fine.
Okay, wonderful. So the first is about the idea of being a caregiver for an older person. How is that kind of operationalized? A number of people, have parents that live in assisted living, but they're managing their affairs, things like that. Does that qualify you as a caregiver?
So you maybe ask some more specific questions about your level of care for the parent. So if they're in an assisted living facility, you probably would not pass the screening questions when asked about that. But it was intended if you have a parent in the home that you are responsible for and you're caring for, absolutely want to vaccinate you to protect that older adult, your older parent. And it's based on the honor system.
Mm-hmm. Okay, thank you very much. Mm-hmm. The other question was about signing up in any county. So you had mentioned that some counties have more, they don't have the demand, but they have vaccine available. Is that allowed?
Yes, that is allowed and I encourage it. So if you find a county where they have vaccine and they have appointments, you are eligible to cross county lines to go and be vaccinated if you meet the criteria for that priority group. The thing I would beg is if you decide to go that route, just remember, if you get your first dose there, we really need you to go back to the same place to get your second dose, because our second doses are shipped to us based on, the first dose given.
Okay. All right. That's good advice. Are there other questions? We also, want to hear from UNC Health about our campus and those kinds of questions. But are there particular questions for Ms. Stewart right now from anyone? Let's see. Ronit, do you want to ask your question? I see it in the chat, but I don't want to get it wrong. So do you want to unmute and ask it directly?
Sure, thank you. So do you qualify for the vaccine if you are a caregiver for any other subpopulation at high risk? And what would they be?
I do believe you are. Again, I think the idea was we were looking at them as a healthcare, similar to like an healthcare aide or a worker. So I used the example of a parent, older adult, but I would need to go back because I can't remember for sure. I'll look at the deeper dive document just to be sure, and I'll respond in the chat.
Thank you very much.
Thank you.
This is Tony Lindsay. I can tell you what the state says on that is that their specific wording is home caregivers providing regular medical care to medically fragile children and adults.
Thank you, Dr. Lindsay.
Okay, right. So that would include if you were caring for a spouse, for instance, or you were caring for even an adult sibling that was medically fragile in your home. Okay. All right. Thank you. That's very helpful. And Jill Moore has put that in the chat too, I see. Okay. Well, Ms. Stewart, thank you so much for being with us today. We really appreciate it. And we will move to UNC Health at this point to talk with Dr. Lindsay and Kathy Brennan and to hear a little more about vaccine on our campus, planning, possibilities, that sort of thing.
Oh, Dr. Chapman, I don't know if Kathy or I should go first. I'm going to talk about the UNC Health effort and where we stand with that now. And I think Kathy was talking specifically about campus. Where should we go first?
Well, it seems like there's a nice segue to what you're going to talk about, Dr. Lindsay. So
okay,
maybe
great. Thank you. I'm happy
can I
to
just
do that.
ask you though, as you're talking, to talk to us about how this interfaces, you know, how the Orange County effort interfaces with what UNC Health is doing. You know, are these allocations separate? I'm sure you will, but I just, I do think some people wonder about that coordination.
Great. That's perfect. Thank you. And I believe I sent some slides over that I think I can talk from. And what I'll try to do is to hit the highlights that others have not already talked about so far. I really appreciate this opportunity to talk to you all. As many of you know, we have incredible experts in infectious disease and specialty care related to COVID-19. And actually some of the people that are on this council are much more of content experts than I am and may be able to answer these questions much more effectively. Can you go to the next slide, please? Can you go to the advance the slide, please? Hello?
Do we have Dr. Lindsay's slides?
Okay, let me try again.
That was the first one.
I think we accidentally, this is such a challenging environment, I have to say. I feel like.
Next.
Go back, please. Okay, and you remember from the slide that Dr. Burks showed earlier that had our predictive model, but embedded in that was the UNC Health census across our system. And you can see back in November that we had a substantial peak that went up and up and up until we were in late December and early January, where our system was incredibly stressed. And we had over 500 patients in our system. There were over right at 4,000 people hospitalized with COVID in North Carolina. So I just wanted to paint that picture for a second before we move on to the vaccine story. So go to the next slide, please. Okay, so there's some key points from that and our predictive model. There's really good news, as Dr. Burks mentioned earlier. There's a rapid decline. This trajectory is incredibly encouraging. The thing that we don't know is what do the variants in this virus hold for us that could be more virulent. We've all read those reports. I think the important message from this slide is the things that we're doing now, trying to vaccinate as many people as want the vaccine, and we have vaccine supply. Doing those things, not letting down our guard on wearing masks and hand hygiene and all those things that we know about. But I think we really need to continue to focus on that to keep this trajectory where it is right now. Go to the next slide, please. And what I wanted to do is by putting the two vaccines on the left, the Pfizer and Moderna vaccines that we have available now, and the Johnson & Johnson one that we expect in the next several weeks available in North Carolina, we hope, fingers crossed, is to tell you this evolution. In mid-November, the pandemic was accelerating. We were on that steep curve in North Carolina, and we thought vaccines were 2, 3, 4 months away. And then all of a sudden, there was this great news that we had first one, then two really effective vaccines. And we were going to get them sooner than we thought we were going to get them. So we rapidly scrambled to try to put together an infrastructure to vaccinate as many people as we could, give as many doses as we were allocated. The only thing to say here about these 3 vaccines is there's some real potential advantages with this Johnson & Johnson vaccine that we're likely, the state's telling us maybe 40,000 doses in a month or so that we're going to be receiving on a weekly basis. It is 1 dose. So people who are less likely maybe to come back for the second dose, it's a good option. It also has, you can store it in a refrigerator for 3 months, which is a huge advantage over this ultra cold storage that are required for these other things. Now, people may say, well, Johnson & Johnson isn't quite as good. Well, many of our vaccines, if you look at the influenza model, they're not great at preventing infection and active disease like the Pfizer and Moderna vaccines are. But what the Johnson & Johnson vaccine, and the published data that we have from the company, says that 85% preventing hospitalizations and 100% in their clinical trial preventing mortality. So that's another key measure of efficacy. So go on to the next slide, please. So this is where our vaccine clinics are located in North Carolina. And we have given, now this slide's 2 days old, so we're probably closer to 165,000 vaccines today. But as you can see from Henderson County, near where I grew up, to Jacksonville and Kinston in the eastern part of the state, this has been an enormous collaborative effort between our physician practices and all 12 of our hospitals and the community health departments. Virtually all of our hospitals have close connections with their health departments and are working in concert, many times moving doses around to try to satisfy the need of that particular county. It is worth highlighting, these aren't UNC Health's vaccines. They are North Carolina's vaccines, and therefore citizens of North Carolina. And we have that in mind every day as we give these vaccines. Please go to the next slide. You've already heard that some of the changes resulted there was shifting eligibility criteria. And we went from the original phases, and you can see that there. The details aren't important. Then in late December, it changed, and we shifted again to that group. Now we have the current groups, and by the way, we may still have some updated guidance from the state on who's in these groups, group 3 and beyond. But it is important to understand the general philosophy of the CDC and the states, including North Carolina, of course, and those of us that are vaccine providers. The strategy is to really maximize benefits and minimize harms related to this virus. And secondly, to mitigate health inequities and promote justice in vaccine distribution. Now, the over 65 group where we are right now and healthcare workers makes sense. The over 65 group makes sense because advanced age is by far the greatest predictor of mortality with this virus than anything else. 83% of COVID deaths in North Carolina are people over age 65. The healthcare workforce, if you remember that peak I showed you on the first slide, we were at a critical point where we couldn't even staff the beds that we had in many of our hospitals. Actually, most of our hospitals around the state were at real staffing crisis. So the state decided to move the healthcare workers first. So that's the current strategy and where we are right now. There's also the equity piece that Quintana mentioned earlier, that African Americans are in fact at higher risk of death from this disease. This has been documented in multiple places around the United States, and it's true in North Carolina as well. one of the things that happened with this real push when we got to the over 65 group back about a month ago, North Carolina realized we were falling behind some other states. So there was a huge push to get out as many vaccines as possible. Matter of fact, we were given a mandate, give everything that's on your shelf within 1 week, or the state's at risk from getting lower allocations. Well, what happened, unfortunately, a lot of vaccines were given. And we moved up the state rankings, but they were given in some instances in an inequitable way. And we're working to try to balance that out right now. And the next slide will help understand that. What we found, this is one example of an issue. What we found that there are a lot of very technically savvy older adults around. And we learned that online appointments will get people who are connected, tech savvy to these appointment slots. And what we found, this is Kinston, North Carolina, a couple of hours from here. And in that first week where we put all these appointments online, what did we find? We found that 64%, you see the dark blue in the upper left of this slide, 64% of the vaccines given at our vaccine clinic in Kinston, North Carolina were given to residents of the Triangle. And it was also a very low percentage of underrepresented minorities. So we said, we've got to do something. So we worked with the team there, and this has happened all over the state in our vaccine distribution clinics. And we've learned that direct calls, having inbound calling is the second best way of doing this, but those lines get clogged quickly. Outbound calling, though, is the most effective way of really achieving this kind of equity that we would like to have. And you can see that one hard week of doing those kind of calls from physician practices, it really flipped this. And all of a sudden, the people were from local areas the next week. And the percent of African-American vaccinations given were receiving vaccines were proportionate to the population. This is, by the way, continued the last several weeks. I don't have the data in front of you on that. So Dr. Crystal Sinay, who Dr. Burks put a picture of early, and her team has been instrumental in accomplishing this goal around the state. Okay, let's go to the next slide, please. Most of this has already been said, and again, we can administer a lot of vaccines, many more than we have. And there is good news that we're going to be up at 200,000 in the state soon. Go to the next slide, please. There are, okay, so yeah, I think it was reasonable to skip that next one. Looking at group 3, the state just updated in the last 24 hours their guidance, and you can see in bold there that the education group, college and university instructors and support staff, that's exactly the wording from the state website, has been added in the last 24 hours there to their website, making it clear that that group is in frontline essential workers. Go to the next slide, please. So what we have done is this enterprise analytics team that we have has used census data and the job codes to categorize frontline essential workers. And within 10 miles of our vaccine clinics all over the state, we have around 273,000 frontline essential workers. This coming week, we just received our allocations last night. We have about 11,000 first doses to accommodate that group, and about 1,200 doses in Orange County right now. So you can see the issues, the magnitude of the mismatch of doses versus demand. Go to the next slide, please. We're hopeful that we're going to get a lot more vaccine. You can read just as well as I can from the federal government, and we're hearing from the state that they're very hopeful about getting more vaccines so that we'll be able to meet demand. We're committed to doing that. The latest info from UNC Health is at the website that you can see there. We will continue to do some element of online scheduling versus phone scheduling, and also the outreach scheduling as we go forward to meet our priorities. So I'd be happy to take any questions about this. Thank you very much for having me.
Thank you, Dr. Lindsay. Are there questions for Dr. Lindsay at this point? Ed Fisher has just kindly written to me and said that he feels like what we're discussing is very important and this information is important. And if we were to run over, he's willing to come back and talk with us in March, should we need to. So I don't think people should be shy about asking whatever questions they might have. And if not, I have one, and that is, so you mentioned that it sounds like on March 10th, this whole category of university personnel writ large would be eligible for vaccine at that point. So that is not, there is no distinction then between people that are teaching remotely right now and people that are teaching in person, or how is that going to work?
Yes, we could have gone, if we'd gone back to that slide, I was trying to breeze through it. I think maybe Quintana had a similar slide. There was a slide. To be eligible in group 3, frontline essential workers must be in person at a place of work and in one of the following sectors. I think it was, okay. There you go.
It's and, that's an important and.
Yeah. Okay. Yeah. All right. And it's all of those sectors. That's why the number ends up being so large. And we were trying to get an idea of what the magnitude, and we use the census data, and it's pretty overwhelming how many people will fall into this. Now that 273 also includes the child care and school teachers who get a 2-week head start as well.
Right, okay. And there's a question from Christina Birch and then from Jennifer Larson. So if y'all will kind of be cute.
Hi, thank you both for that. I feel like I learn more at these meetings than anywhere else. But I felt like we got a little bit different messaging from Quintana and from Tony, that Quintana was saying that in Orange County, K through 12 teachers will probably not have access starting February 24th. And I inferred that then UNC faculty would probably not have access March 10th. And she encouraged us to go, say, to Kingston or wherever to go, if we could, to go get our vaccine. And I feel like we've got the flipped message from Tony. So maybe you could try to tackle that.
I think that I can absolutely see how that would come across that way, but I don't think what she and I were saying were very different. I think what and she's going to correct me, of course, if I'm wrong. They have an enormous wait list right now. It's 20,000 or something, and of people over age 65 or healthcare workers, that they don't feel like that they can move forward into that next phase. What we are going to do is we're going to continue our efforts as we are. We think the 65 and over group is very important, but the CDC has a principle. If you get to the point of having approximately 60% of a group vaccinated, we know that about 30% of people aren't going to get it anyway because they're concerned about it and they're very hesitant. So you should probably move on to the next group. So the state's telling us we're around 50% now statewide. So we're going to open it up for those teachers, but also continue on with the 65 and over and any other healthcare workers who have been hesitant to this point. We are going to put them in the same queue, if you will, and give them the same access. I hope that helps clarify.
So it sounds like these dates are dates where you could, but not necessarily where you will, because that would depend on your waiting lists and your availability of vaccine. Is that a fair summary?
I say yes. And I would say, Dr. Lindsay, you answered it correctly, spot on. That was exactly the sentiment. So health department, again, based on the allocations that we receive and our wait list, we do not feel it's not possible for us to go ahead and move forward at this time. But I would say UNC, high throughput, a larger allocation, they probably will get to that point before the health department does.
Okay, all right. Thank you. We have a question. Jennifer, did you want to ask your question? And then Eric Muller has a question. Eric, let's go to you, and then we'll come back to Jennifer if, assuming there's a technical issue.
Okay, thank you so much for the presentation. I should probably be on video here. So the question I had was about, for quite a while, there were stories circulating about, doses that were available at vaccination sites at the end of each day. These things obviously shouldn't be thrown in the trash, so there would be canceled appointments and so on. And there were lots of stories circulating about people kind of hanging out or getting phone calls and being offered vaccine that would otherwise spoil. Could one or both of you please address whether those systems exist, and if so, how they're working?
I can say from the UNC Health standpoint of how that's being managed. The issue with these, you thaw these vaccines and you open a vial, and they either have, we get 5 or 6 out of a vial of Pfizer, you get 10 out of a vial of Moderna. And if you thaw too much and someone doesn't show up for their appointment, or it's an uneven number, you're typically going to have, and if you look at this huge throughput Friday center, we typically will have 5 or 6 doses at the end of the day. What we have been doing, the state has given us very clear guidance not to waste 1 dose. And what we have done is we have reached out to some businesses who have a lot of frontline workers who are at risk. For instance, but it's got to be very close, because the vaccine, we only have them, you got to really be within like 10 minutes of the site. So all over the state, they have places where they're reaching out to frontline essential workers that are in this next category and trying to vaccinate them, particularly if they're older. They're trying to stratify via age. We've vaccinated a lot of people from some of the grocery stores that can get to the Friday Center quickly. The staff that work directly with the patients coming in and out of the Ronald McDonald House and the SECU House, those are a couple of examples of how we're using those, typically 5 or 6 doses at the end of the day. I don't know what Quintana's experience with that is.
Right, and so I can say for the vaccination pods that the health department has managed, at the end of the day, you're right, it's never many, but at the end of the day, if we had a couple of folks that missed, or we got some of those extra doses from a vial, we would first look on site at the volunteers that were working at the clinic. And so early on, it's really not the case now, because so many of them were healthcare workers, and so they've been vaccinated. But early on, we would first check in with the volunteers that were on site working. And so when we had a vaccinator or someone doing the patient monitoring who had not yet been vaccinated, then we would give those extra doses to them to make sure that they were protected. But as the weeks have progressed, we've now gotten a better system in place. And so we identify folks on our wait list, and we have them up and ready to call if we get towards that last hour of the clinic and we realize we may have a few extra doses. So then we start to call the folks that are on our wait list in the priority groups to see if they are able to get to the site in a relatively short time, so that the dose is not wasted. I am happy, and I almost don't want to say it because I don't want to jinx it. This is wood. We have not yet wasted a single dose. So,
bravo, that's wonderful news. Let's see, Jennifer Larson has a question, and that is, she's hearing from colleagues teaching in person. What will we have to do to prove that we are in-person frontline workers? If the university sends some kind of list of eligible folks, how will we know that we are on it? So, and that might be a question for Kathy, or
yeah.
I'm not sure.
Yeah, so I can address that. I was going to speak to that a little bit in my presentation,
right.
But as of now, the state is not requiring employers to send eligibility lists like they did with healthcare workers. So for example, for the K through 12 teachers and childcare staff, that is a self-identify process. So you don't actually have to submit a list that the following people are eligible. So as has been noted, the state guidance has changed throughout this, so that could change, but as of now, it would be a self-identify.
Okay. Let's see, maybe it makes sense at this point, Kathy, to go to your presentation. I don't see any other questions right now.
Okay, I'm gonna pop that up real quick. All right, well, thank you for inviting me as well. So I will talk more on the university side and what we've been doing in terms of vaccination planning. I do want to make clear that we are not currently vaccinating people. So everyone that would be part of the UNC community would either go through UNC Health or Orange County Health Department or their local health department where they reside. But I do want to give some updates on what we've been doing, like I said, on the university side. So we established a COVID-19 vaccine working group at the very beginning of December. And, you know, our objectives really were to advocate for the UNC community. We wanted to make sure we had a standard decision-making process. And as has been mentioned, we are following the UNC-CH requirements in terms of prioritization. So we closely follow that and the rapidly changing state guidance that comes out pretty much on a sometimes daily, but mostly weekly basis. New things are released from the state. So we have really the main objective of the group is to really track that guidance and make sure we're advocating for the UNC community. And we have representation from various campus units. I have them listed here. We, you know, have tried to hit kind of the different units. It was pretty heavy on the healthcare side in the beginning because that was the group one. So School of Medicine, School of Dentistry, and our health professions units. But we have added additional units as we've gone along. And we do meet weekly to discuss that recent guidance because it does change so rapidly, and try to make sure that we're informing the community about the changes. So you've already seen this. Quintana had it in her presentation, but just a reminder again that the university has to follow the state guidance just like everyone else. And they have this specific framework. Currently, there's 2 active groups, as have been mentioned previously. So we are currently trying to advocate for those 2 groups. So just to let you know what the university has done. So for group 1, the healthcare workers, at the very beginning, as Tony said, it was a little bit different. When we first started, there was a group 1A for high risk healthcare workers, and our working group had to identify who those high risk healthcare workers were. The state then changed it to all healthcare workers with in-person patient contact. So we had to pivot and pull those lists because with healthcare workers, we did have to upload eligibility lists to the state system. We've partnered with UNC Health on this. They've been very gracious in allowing us to be part of their planning and to upload lists to CVMS through UNC Health. So we've uploaded thousands of UNC healthcare workers since that time, and we continue to upload those people as we find out about new employees. And also our volunteers at our vaccine clinics are also eligible through the group 1. So we've been uploading those folks as well. In terms of group 2, older adults, so in this case, people do self-identify. So the university really doesn't have any role in, you know, helping them be registered and scheduling an appointment. But what we have done is try to inform the community that they are eligible when that came out. That originally it started, you had to be 75 and older, and then the state changed it to 65 and older. So we tried to get that information out to our community members that would fall into that bracket. the next phase is the one that most people have questions about. And as Tony mentioned, education is part of one of the 8 essential sectors, which includes college and university instructors and support staff. But as was mentioned, the first priority from the state is childcare, pre-K, and K through 12 teachers. So we do have folks at UNC that meet this first priority. For example, our student teachers from the School of Education. We have others that might go into K through 12 schools, nutritionists, social workers, those sorts of things. So the working group is trying to make sure that we are identifying those people that might be part of that first priority and communicating with them about how best to get their vaccine. So we're continuing to work on that. And then the expanded group 3, that is supposed to start on March 10th. The last I heard, and maybe this has changed, it was a little unclear if that March 10th date was going to be all of group 3, or if there would be a further subgroup that would be released like they did with the K through 12 priority. So we're closely watching that. And again, as we learn more, we'll distribute that information. And then the last 2, you've seen these already. Group 4 would be adults at high risk, and group 5 would be everyone. And as Quintana showed, Campus Health has registered to be a vaccination site. They have not received a vaccine as of yet, but I think most of us think they'll probably start receiving vaccine at the group 4, group 5 stage. And they are actively planning, because most of our students would be in the group 5, everyone category. They are actively planning how to do mass vaccination of students. And then the last thing, this is my last slide, just to let you know that we have a COVID-19 vaccine information webpage on the EHS website, and we do update that at least weekly and sometimes more often, depending on the new state guidance that has come out. So I'm happy to answer any questions as well.
We have a couple in the chat. Kathy, if you don't mind taking those. Let's see. So the first one is from Jill Moore. Will we be working with OCHD, UNC Health, or another provider to provide a dedicated vaccination clinic to our group 3 staff and faculty?
Yeah, so that's a great question. I think we have a very close relationship with both of those partners. And I do know the state has said that can be done. I think at this point, we haven't, based on the allocations that have been given, we haven't really discussed doing that. But it's possible as supply increases that we could partner to do something like that. I don't know. We've mostly been sending people through UNC Health, so Tony might want to answer that as well.
I think the answer to that is certainly, from the UNC Health perspective, is we would love to have enough vaccine to do that. We're, as you might imagine, we're getting the same requests from every other of those 8 categories, and we're trying to weigh it all and trying to do something that's equitable and fair, and that's where we are right now. And we don't have a definitive plan for group 3. We've got we're 2.5, 3 weeks away from that, and we're trying to develop a plan that's the most thoughtful that we can. That's all I can say. I wish I had an answer today.
Thank you. Another question.
Can I say one other thing, Mimi? I think it's hard. One thing that's hard for us is this thing that we know that the 77-year-old who's still sitting there trying to get a vaccine, we can't forget them. So it's just such a bind that we feel right now, and we're agonizing over it. I hope you can understand that.
Absolutely. Yeah, thank you. The other question that I'm seeing is about students, and that so students that are, for instance, teaching in are doing student teaching in K through 12. We know students who have been in the health settings have been eligible for vaccine. And then other kind of folks like we, for instance, in the School of Social Work, we have students that are placed in K through 12 settings for their field placements when those schools are in session and open. So would those students be eligible for vaccine?
Yes.
Yes.
Yes. So the first priority group 3 for the K through 12, the state clearly defines that student teachers and people like social workers, nutritionists that go into K through 12 schools meet that criteria.
Thank you very much. Any other questions at this point? Okay, I'm not seeing any other questions. Ed, I think if it's okay with you, we will delay your presentation until March. Thank you for your flexibility on that. Ven, thank you. Ven, did you want to do a few reports?
Yes, and not to prolong the meeting, let me just ask if there are any questions on the 2 committee reports that have been posted on the agenda for us to accept by title. If there are no questions, we will consider them accepted. If there's a short question, we'll take it. And if it's a long question, we'll defer it to the next meeting or transmit it. But so let me first ask, are there any questions on either of the 2 reports that are on the agenda by title? Seeing no questions, let us consider those reports accepted by title, and let me pass the gavel back to me.
Okay. I think that concludes our agenda for today. I want to thank our guests in particular, both those we heard from and to Ed Fisher, who we were unable to hear from today, but we will get back to you and hear about your important work. But to Dr. Burks, Dr. Lindsay, to Ms. Brennan, Ms. Stewart, thank you so much for being with us today. Really very much appreciate it. And to everyone else for hanging in there. Motion to adjourn.
So moved.
Okay, thank you. And we are adjourned. See you next month.